Children of Standard 6. From the previous few classes, I have been discussing the components of food. I discussed the nutrients of food, their function and their sources. I discussed the balanced diet, water and referees. I had begun to discuss deficiency diseases. I have already discussed Kwashiorkor and marasmus. After discussion of vitamin deficiency diseases, now we come to the discussion of mineral deficiency diseases. Deficiency of various minerals in the human diet also gives rise to a number of diseases, or you can say disorders. Some of the mineral deficiency diseases are Rickets, Cretinism, goiter and anemia. We will now discuss the diseases caused by the deficiency of minerals. First, deficiency of calcium. When a child is born, its bones are soft. For the bones to become hard, calcium compounds must be supplied. If a child does not get sufficient amount of calcium, its bone remain soft and bent under the weight of its own body. This is called rickets. Thus, the deficiency of calcium in the diet of the children causes a disease called rickets. The main symptoms are weak and brittle bones, and the main symptoms of the rickets are bow legs and pigeon-type chest. The deficiency of calcium also leads to poor growth of teeth in children, and the ricket is a children's disease which is caused by the deficiency of vitamin D as well as by the deficiency of calcium in the diet. Deficiency of calcium in adults also causes osteoporosis. Osteo means bones, porosis means pores. So, the bones with many pores. So, it causes by the deficiency of calcium in adults' diet. The disease can be cured with the supplement of milk products and nuts in their food. Next mineral is iron, and iron mineral is necessary for making hemoglobin present in our red blood cells. Deficiency of iron results in the blood containing too little hemoglobin, and the function of hemoglobin is to carry oxygen in our body. Due to deficiency of hemoglobin, the blood of a person is not able to carry sufficient oxygen to all the body cells to meet their requirement of oxidation of food. And all of us know that the respiration is the oxidation of food by which we can get energy. So, anemia is a disease that is caused by the deficiency of iron, and its symptoms can be reducing the oxygen carrying capacity of blood, and thus the deficiency of iron in the diet causes anemia. And the symptoms are fatigue, pale skin, white nails, loss of weight and loss of appetite. And the disease can be cured with the supplement of food that are red meat, liver, pulses and whole grains. So, the disease caused by the deficiency of iron in our diet is anemia, and its symptoms are fatigue, pale skin, white nails. So, now the next mineral is phosphorus, and its deficiency causes rickets in children. And rickets, the symptoms are weak bones, stunted growth, teeth deformities, bow legs, pigeon chest, and curved spine. And the supplement diet is meat, fish, potato, and banana. Now, next mineral is iodine. The deficiency of iodine mineral in the diet can cause two diseases, that is cretinism and goiter. The deficiency of iodine in the diet of a children causes a disease known as cretinism. Cretinism means feeble-mindedness. The main symptoms of iodine deficiency in children are retarded physical growth and mental disability. The deficiency of iodine in the diet of an adult person causes a disease called goiter. Goiter is the abnormal enlargement of thyroid gland situated in our neck. This enlargement of the thyroid gland is caused by the deficiency of iodine, and the main symptoms of iodine deficiency is that the neck of a person appears to be swollen. The goiter disease is more common in hilly areas because the drinking water and food grown in such areas are poor in iodine. The goiter disease does not occur in coastal areas because coastal people eat a lot of seafood like sea fish, which contains good amount of iodine. The most common source of iodine mineral in our homes is the iodized salt used in cooking food. So the seafood and iodized salt are the advised food for the person who is suffering from goiter and cretinism in the children. Next minerals are sodium and potassium, and their deficiency causes muscular weakness and paralysis. The symptoms of the lack of sodium and potassium in our diet are muscle pain, weakness, vomiting, diarrhea, difficulty in breathing. So the person who suffers from the lack of sodium and potassium can be supplemented with common salt, cheese, meat, and fish in their diet. So this is all about the deficiency of mineral causes the different kinds of diseases and the symptoms of these diseases, and how by adding these minerals in a small quantity in our food can cure us and can prevent us from getting these kind of diseases.